Okay, so for the catheterization, I would first provide privacy. I would perform hand hygiene. I would identify myself or introduce myself and identify her with two identifiers, her name and her birth date on the wristbands. I would ask how she's feeling, and I would put her in a supine position with her knees flexed out. I would then, sorry, I just need to go find gloves. Okay, so I just got them from, okay, so these aren't sterile gloves. I would palpate the bladder and kind of assess kind of how she's doing. I would clean with soap and water if needed. So then I would dispose of these. And I would just tell her what the procedure is going to be. I would then get my sterile field, or first I would get this guy out. So the shiny side down. I would just tell her to lift up a little. This is for any leakage. And then I would get this one. And place it like that. So I got that ready, and now I'm going to get my sterile gloves on. Okay, so now I'm going to get my equipment opened. I'm going to open this. Then I'm getting my lubricant. And I'm going to lubricate the catheter. Keeping everything in the sterile field. Okay, so now what I'm going to do is I'm going to bring this over like this. So I have it in front of me. So I'm going to open up the labia. So I'm going to do one side, throw it out, the other side, and down the middle. So now I'm going to get my catheter ready. I'm going to put one end of it into my cup. And then I'm just going to tell the patient to take a deep breath as I insert it. And then once I feel resistance, I'm going to push it in 1 inch more until the urine starts flowing out. So I see urine, I'm then going to collect this specimen and put it off to the side. And now I'm going to tell the patient to exhale, and we're going to take the straight catheter out. And I would then dispose of this into the garbage by me. And I would take off my gloves. I would make sure the bed is lowered again, her collar is by her. She's in a comfortable position. I would perform hand hygiene. I would make sure she's all set and doesn't need anything. I would make sure her bladder is feeling fine. I would also document drainage, the color, the amount, the odor, how she tolerated the procedure, and yeah.